Are there any women who shouldn't consider epidurals or who it might not be safe for?
If somebody had had extensive back surgery, severe scoliosis, or an infection of the skin in the low back area, or if they have a bleeding disorder that is acquired by taking blood-thinning medicines, or a genetic bleeding disorder like hemophilia. In those situations, your obstetrician, I'm sure, is well aware and would enlist the help of an anesthesiologist and come up with a customized alternative to pain relief for your laboring process.
I do remember, though, when I was having my children, wasn't there a phase of labor where it's most recommended that you do the epidural, like you wait until you're 4 centimeters dilated? Is that correct?
The research shows that you can have an epidural anytime. Anytime is a safe time. But if you're concerned, you can wait until your labor contractions are occurring at a regular pattern, and that usually coincides with the cervix being dilated about 4 centimeters.
Is there a point at which you say, okay, if you want an epidural now, we need to do it now? Because again, I have never given birth. My wife will soon give birth.
Yes,
and
she is quite honestly asking me a lot of questions about epidurals. And although I do a lot of lumbar punctures in the emergency department, I don't do epidurals. And there is this element of, do I need to decide now? Can you wait and see? Can you just address that?
You can tell he's an expectant father there. He wants to get all the information he can.
I love it, I love it. I think the most important aspect of having a birth plan is remaining flexible. Because if you're just very concrete about this is what you want for your birthing plan, there's no room for flexibility. And you can't really control how the baby is going to be born, if they're going to breech, or if there's a cord around their neck. A lot of variables you cannot control for it. So if you keep a flexible plan, I think that's the path to birthing
Because you might need an emergency C-section. You might need, you just don't know.
Yeah,
exactly.
Because you have to constantly communicate with your OB-GYN and your anesthesiologist, because those kids do what they want to do.
Yes.
Like they're going to be in the position they want, they're going to come when they want to come, and you just have to kind of be flexible and open-minded about
What
the
I will
safest
say is
approach.
this, the birth plan is one that should be decided between the doctor and the mother-to-be, not the mother-in-law.
Yes.
Is that fair to say? Do we all agree?
Yes.
Yeah, okay. The great irony is my wife's obstetrician, guess her name.
Is it Dr. Landry?
It's Dr. Stork.
Oh, Dr. Stork.
Yes.
Are you?
I trained with her, and she's Dr. Stork with the wonderful obstetrician. There is a C in the last
fantastic.
name, but
I
yes.
see. So it's same,
that
but-
Dr. Stork makes all those decisions. This guy's just playing supporting husband role. Thank you so much.
Thank you, Dr. Ma.